So I go back to the question I asked earlier. Who's in your network? When that implant goes into the orbit, and it will, or you get the extraoral cutaneous fistula, and you will, where are you going to send this patient? Who have you developed a relationship with that is meaningful, that is going to help you? And if you have that network in place, more power to you to do the surgery, but make sure you have that in place.
Well, let me give you an example. If I have an implant complications, I refer to one of you guys. But now let's ask, because it's always context, right? So now let's just compare. I'm a GP, I have an implant complications, I refer to you. Rob, you're an oral surgeon. What complication do you have to where you now have to refer to an oral surgeon?
With implants, probably none.
Exactly my point. So we're talking about complications, right? So if I can't, as a general dentist, manage the complication, right? You follow where I'm going with that?
I follow you.
So the game is not necessarily implant placement.
Right.
It's more about the game of complications, and it will happen. So the argument is, and I've heard this online, I don't have complications. My cases don't fail. And I know that's not necessarily the case. But I can understand that it's 3% or 5% or 7%, but you're gonna have them. But guess what? Those 5% of the patients that you have complications are gonna be 95% of your problems, right?
That is correct. And what is another interesting phenomenon that I see, or whatever you want to call it, pattern that I see, the people in my community who I consider to be the absolute most elite, most well-respected, and most successful restorative dentists do not do implants.
I agree.
Period.
100%.
Period. They don't, and they will proudly tell you, I am so busy doing crowns and bridges and restoring implants and doing veneers, I don't have time to do implants. And these are the same people that are on the speaking, circuits and things like that. Now, are there talented dentists that do implants? Absolutely, yes, there are. But to your point, that's a question that not only the dentist. I saw something earlier on Facebook, and it said something like, if you're getting an implant complication, every surgeon is going to have, kind of like what I've been saying, every surgeon's going to have complication eventually. Does that mean I shouldn't be doing this surgery? And my answer to that question is, why don't you ask your patient that? Ask your patient.
That was my post from this morning.
It was actually. I think that's the one I said this too. Don't ask me if you should be doing a surgery. Ask your patient, hey, if we get a complication that I'm not able to manage, you okay with that?